Hello and welcome to the Obstetrician's View. Today we're talking about something many pregnant women experience and are often worried about. That is long pregnancies, also known medically as post-term pregnancies. You may have heard some statement like, my baby is overdue. It's already 41 weeks. Why hasn't labor started? Is my baby okay? Should I wait or should I be induced? Many women become anxious once they pass their due date. Family members also get very worried and begin to call every day asking, have you delivered? What is happening? It's all well. But what really happens when pregnancy goes beyond the expected date of delivery? Is it dangerous? Why do some pregnancies even last longer than the expected date of delivery? When do doctors intervene? So today we'll discuss what a long pregnancy means, why it happens in the first place, what are the risks to the mother and the baby, what are the signs to watch out for while monitoring an overdue pregnancy, when should induction be done, and then we'll talk about some myths and facts and what every pregnant woman should know about a prolonged pregnancy. So stay till the end because this information may help you or someone you know avoid unnecessary fears and complications in pregnancy. So let's dive into it. What is long pregnancy? So a normal pregnancy usually lasts for about 40 weeks when calculated from the first day of the last menstrual period. And pregnancy is divided into term pregnancy, that is between 37 to 40 weeks, late term pregnancy, that is 41 weeks, and then post-term pregnancy when it is 42 weeks and beyond. So when someone says, I am overdue, it usually means pregnancy has gone beyond the expected due date. So now here is something important. A due date is only an estimation, and that's why it's called expected date of delivery, not sure date of delivery. So only a small percentage of women deliver exactly on their due date. Many healthy pregnancies naturally continue a few days longer. However, once pregnancy extends too far, doctors become more careful because certain risks can increase with prolongation of the pregnancy. So why do some pregnancies even last long or longer than the due date? In many cases, we do not know the exact reason. Yes, it's amazing, but yes, we do not know the exact reason. But some factors have been known to increase the chance of prolonged pregnancy. One is wrong dating of the pregnancy. This is one of the commonest reasons for a pregnancy being perceived as prolonged. If the woman does not remember her last menstrual period or has an irregular cycle, then the estimated due date may be inaccurate. Sometimes the pregnancy is not truly overdue. The dates were just simply wrong. In these instances, an early ultrasound is very important to help date the pregnancy. Another is first pregnancy. Most women who are having their first babies are slightly more likely to go beyond their due date. The reasons for this are not very clear, but that has been shown to be a risk factor for prolonged pregnancy. Another is a previous prolonged pregnancy. If a woman has had a previous prolonged pregnancy, then the chances are that she may have a repeat prolonged pregnancy. Another risk factor is genetics. Sometimes prolonged pregnancies run in families. So women whose mothers or sisters have had prolonged pregnancies are at risk of having a prolonged pregnancy. Male babies are another risk factor. Interestingly, male babies are slightly more associated with prolonged pregnancy. The reasons are not clear, but we probably may have to ask the male folk why they prefer to stay there longer. Obesity, maternal obesity, is yet another risk factor that have been shown to be associated with the likelihood of post-term pregnancy. So what happens to the baby in a long pregnancy? Many overdue babies are born healthy, without any problem, without any complication. But as pregnancy continues beyond 41 to 42 weeks, the placenta may gradually become less efficient. And this is actually the problem. So remember, the placenta supplies oxygen, nutrients, and blood flow to the baby. So as it ages, problems may develop with increasing age of the pregnancy. So some possible effects on the baby are reduced placenta function. The baby may not receive enough oxygen or nutrients as required to keep up with its development. Low amniotic fluid is another thing that can happen. With increasing age of the pregnancy, the fluid around the baby may reduce, and this is called oligohydramnios, resulting in what is called oligohydramnios. So low fluid can cause compression of the umbilical cord, resulting in stress to the baby, and may also cause increased labor complications. Other things that can also happen are meconium stained fluid. This is when the baby passes stool inside the womb. This stool is called meconium. If this is severe, it can get into the baby's lung and then can cause breathing problems after birth, known as meconium aspiration syndrome. The baby can also continue growing and become very large, resulting in difficulties during labor, birth injuries, what is known as shoulder dystocia, and increasing the risk of cesarean delivery. Post-maturity syndrome is also something that can happen. So in this situation, the baby appears thin, dry, with skin spilling, with usually very long nails, and then the fat under the skin becomes reduced. This happens because the placenta is no longer functioning optimally. Stillbirth is yet another risk to these babies. Although still uncommon, the risk of stillbirth gradually increases after 41 to 42 weeks. This is why close monitoring becomes very important if this pregnancy lasts for this long. What are the risks to the mother? Long pregnancies can also affect the mother, and the risks to the mother include prolonged labor. Labor may become more difficult in cases of prolonged labor. There is also an increased risk of cesarean section, especially if labor fails to progress, the baby becomes distressed, or the baby is too large. There's also the risk of injury to the birth canal during the delivery proper. Large babies can increase tears, bleeding, and injuries to the floor of the pelvis. There's also the risk of postpartum hemorrhage, that is bleeding immediately after delivery. Heavy bleeding after delivery may occur, and this is quite often. Emotional stress. Many women become anxious, exhausted, frustrated, and emotionally drained when the pregnancy is overly prolonged, especially with constant pressure from family and friends asking, why have you not delivered? We have been counting. Is this pregnancy not yet coming forth? Or is the baby not yet out? Cause and all of that. It poses a lot of stress on the mother. So how do doctors monitor an overdue pregnancy? Once pregnancy goes beyond the due date, doctors monitor the mother and the baby more closely. And this monitoring may include a fetal movement or kick count, where the mother is involved in the monitoring her baby's movement, and reduced movement is considered an emergency sign for which she is expected to go to the hospital immediately. Another thing that can be done is an ultrasound scan. An ultrasound scan can tell us about the heartbeats of the baby in the womb and other relevant information that tells us about the baby's well-being. Also, what we call a biophysical profile can also be done that gives us an idea of the well-being of the fetus, that's the baby in the womb, and can reassure us up to 1 week. These are some of the things that can be done, and they are usually continued until the pregnancy is ended. They tell us when complication is setting in and give us like an emergency sign of when something is going wrong. So let's talk about some common myths about overdue pregnancy. The first is walking guarantees labor. While walking may help with the onset of labor, it does not guarantee the onset of labor. Another is that spicy foods induce labor. There is no strong scientific evidence to support this. So don't go stuffing yourself with spicy food because you want to initiate labor. The third is once overdue, cesarean section is compulsory. This is not true. Many women still have successful vaginal delivery even when their pregnancies lasted past their due date. The fourth is the baby is always in danger after the due dates. Like we have discussed, the risk of danger increases, but that does not mean that the baby is in danger. The risk of complications increases, but it doesn't happen in all situations. Many babies remain healthy with proper monitoring. So what should pregnant women do? If your pregnancy is approaching or passing the due dates, attend antenatal visits regularly, monitor your fetal movements, stay hydrated, and follow your healthcare provider's advice. Go for recommended scans or tests. Avoid self-medication, avoid unsafe herbal mixtures or spicy things, like we have said, just to induce labor. Do not delay hospital reviews. Do not ignore any perception of reduced fetal movement. A long pregnancy can be stressful, yes, emotionally and otherwise, but most women can deliver safely with proper monitoring and timely intervention. So the key message in all of this discussion is being overdue does not automatically mean danger, but it does mean closer attention is needed. Always maintain good communication with your healthcare provider and avoid relying solely on myths or social pressure. Every pregnancy is unique. Thank you for watching the Obstetrician's View. If you found this video helpful, please like, share, subscribe, and follow the Obstetrician's View on YouTube, Instagram, Facebook, and TikTok. I would also like to know if you had a prolonged pregnancy or you know someone who had a prolonged pregnancy. How did it turn out? I'll see you in the next video.